And then we have a couple different types of treatments that we do here. We do the full treatment, which is just the normal braces with or without extraction. Phase 1 treatment is for younger kids to help with like their jaw development, things like that. And then phase 2 is the same thing as the full treatment, but that's for like, the individual position of the teeth. And then I don't think we're doing incognito before, but those are the braces, these gold ones on the lingual side of the teeth. And surgical, it's when the patient has jaw irregularities, so they would need to get braces first to align their teeth, and then get jaw surgery to complete their jaw, and then finally get braces again to finish making their teeth straight. And then also we do the Invisalign. And then the picture on the left is for like phase 1 treatment, where it's called an expander, where you just expand like the arch, so the patient has more space for teeth to come in. Okay, and then for the type of brackets, we have 2 types of brackets. So we have metal and porcelain. The metal ones are the metal ones, and then the porcelain one is like the tooth-colored ones. So Dr. Chen, so I guess different orthodontists have different ways of thinking about this, because Dr. Navarrete says that porcelain, it can delay your treatment, so he doesn't really recommend the porcelain, but Dr. Chen says that it has no effect on your treatment at all. So he usually recommends like the upper 6 for most adults. And then like the different parts of the bracket are slats where the wire goes in the middle of, the 4 wings, and then for some of the brackets they have hooks where you can attach like elastics and stuff. So then at the next appointment, we take records to see what their teeth were like before they started braces. So we have a record of how their teeth changed throughout time. Yes. So first we would take an impression, and we would take a couple tray sizes. We use the Invisalign trays, and then trial fit it to the patient's mouth to make sure their molars all fit into the tray that's the right size. And then for ortho impressions, we usually take it with alginate. So we just mix the material with the correct proportions of water and alginate, and then we load it. I know.
This has to be a record.
Okay, so then you take the impression, and then right now we're sending it out to a lab in 3M where they just scan the impression, and then we have a digital one in our office. It just looks like the one on the slide, and you can just manipulate it, open the arch, take measurements on it, so it's pretty useful. Another thing that we do is we take panos, is the 2D x-ray of both the upper and lower jaws. It's used to see what teeth are coming in and what position it has in the mouth, so the orthodontist can kind of make a plan for how he's going to complete the treatment. So we also take pictures, intraoral and extraoral, of the patient's teeth and side profile and how their smile is and things like that, and we can use this to classify their teeth and also to keep our records. And then one more thing that we take is now we take the Ceph x-ray. It's a side profile x-ray of the patient, and a lot of things show up like teeth, bones, soft tissues, so the orthodontist can use all of that to kind of make a Ceph tracing to see the angles of their teeth and how their jaw is aligned, so they can predict those structural changes throughout the treatment. And then lastly, of course, they need a cavity clearance. So at our office, we require them to have a recent cleaning, recent x-rays, and recent exam within 6 months. So after we take all the records, then the patient is ready for bonding. It's a little video that shows how bonding is done. so first, retractors are placing them out to isolate the area. And then orthodontists may or may not place cotton rolls. And then using pumice, it's kind of different than the regular Profi pumice, but you use that to polish the outside of the tooth to make it clean.
So cool.
And then they apply, I believe that's the adjuvant, and then it turns, and then you rinse it, and then you dry it until it turns into a chalky clear. And then after they apply the primer to the tooth, and then on the back of the bracket, they have a special type of adhesive that they put on, and then you attach it to the tooth, and then use something to scrape off the excess. And then the orthodontist can position the bracket to how he wants his tooth. Oh, and then you have to cure it with the light.
I could do myself. Cool.
All the brackets are put on. Okay. And then there's also different things that can go on molars, and I'm not quite sure how the orthodontist chooses whether to put the molar bands or the bondable tooths, but so the molar bands are bands that actually go around the entire molar, and then there's two types, just normal molar bands and then molar bands with the headgear tube. So I think younger kids usually get the headgear tube if they need it, and it has an extra hole like over here that's bigger where the headgear attaches so they can wear it at night. And then there's also bondable tubes. These go on the molar similar, so it has the same function as the molar bands, but it doesn't actually go around like a ring on the tooth. And then this next video, I think it goes over the separators. So if you want to be able to put the molar bands, you need to create some space for the band to fit around the tooth. So about a week before the patient is scheduled to be banded, we place in these rubber separators that create spaces between the teeth. So little round things, and then it's kind of hard to put on with the patient, but it's easier. Yeah. Okay. And then we want to try not to have it for longer than a week, because it gets really uncomfortable for the patient, because it just feels like there's something stuck in your tooth. Okay, so those are all the brackets with the wire, and then the molar tubes on the back two molars. Okay, and then sometimes when a patient has a deep bite, or they have a bite where it can break off the brackets in the front, then the orthodontist may do something called occlusal bonding. And they put like a type of adhesive on the occlusal surface, the biting surface of the tooth, to raise the bite, so they're not going to bite off their brackets when they chew. So the first picture, the same thing, they clean the area, etchant, primer, and then this one is where they actually apply the adhesive. Usually the orthodontist uses a different color, like blue adhesive, so it's when they take it off, it's easier to tell from the tooth itself. And then the last picture, they cure it with the light. Okay. And then after they have their brackets put on, they have different arch wires. So usually they start from the most pliable type of wire, which is nighttime. They keep moving up to different thicknesses and also different types. So they have nitinol wire and then also stainless steel wire. And then they also have other different wires like beta 3, but I'm not quite sure what the difference is between the wires. So the type of wire is usually chosen by the orthodontist. So the orthodontist will tell the assistant, I want this type of wire. So the assistant will then trim the wire to what they think is approximately the right length, and then they usually will cut it at an angle, so when they put it in the bondable tubes or in the molar bands, it's easy to slide in since it's not, it's angular. Okay, so once the arch wire is in place, you need to match the midline of the wire to midline of the patient so their teeth don't shift either way and it creates a nice arch. So when you look at a wire for a lower wire, it's usually one dot like this, and then for an upper, it's three like this, so you can distinguish top and bottom when you have both on the tray. So you want to make sure the middle of these wires are aligned with the middle between the patient's two front teeth. And then check the center so we can watch these videos. So once you have the wire secured in the brackets, you need some type of ligature tie or something to hold the wire in place. So that can either be rubber ones or steel. So there's a couple different types. So this one's the most common one. It's just the individual rubber bands, the different colored ones. So each one will just fit over the bracket. It just looks like that. And then this one is a power chain or elastic chain. It's usually used to close spaces to bring the teeth in, like this animation will show. Just goes over each bracket. One thing that's wrong with this video is that on the very end, usually they only do half of this bracket and then do the other half with a single tie, but this one does both, which is, I don't think is right. So, and then there's also like stainless steel ties, which look like this. Basically, it's kind of a tighter way to secure the wire to the bracket. So, you can watch this video. So once you have the arch wire on, you can place the tie around the bracket, and then you just use like a wine guard or something to twist the end, and then you just clip it off, and then tuck this under the wire so it doesn't poke the patient. So it's a different type. So once the wire is, in the molar bands and then also all ligated to each bracket, then you need to trim the wires at the back to make sure it doesn't poke the patient. The distal end cutter is used so the piece of wire doesn't fall out of the patient's mouth, because when you cut it, the wire cutter just holds onto the wire so it doesn't fall anywhere. The length of the wire should be at least 5 millimeters from the distal side of the molar band tube prior to insertion, so that just means you need to make sure you have enough space to be able to cut the wire, because if it's too close to the band, it's going to be hard to cut. And then for the more pliable wires, like the 0.012 or 0.014 tie, when patients eat, it's really easy for that wire to come out because it's so soft. So for that wire, you need to do something called cinching back, and that one is, it's like this picture where you just twist it up a little bit so it doesn't come out of the bondable tube or the molar band when it gets stuck to tooth or it gets caught on something. So in order to do that before the wire is facing the mouth, it's just heat treated with a lighter or something like that to make it cold or hot and red, and then after it cools, you place in the tubes, place the ties, and then you use some kind of pliers to bend the end of the wire so it doesn't pop out of the molar band or the bondable tube. And then finally, at the end of treatment, when we remove brackets, we use this bracket removing plier, and then it has a round spot at the top to be able to hold the brackets, and you want to do this really quickly in a fast manner so the patient doesn't have time to react, and also the slower you do it, the more pressure it puts on their tooth, so you want to do it like snap, snap, snap really fast. And then we use these cement removing pliers, so this is kind of like a rubber base with kind of like a not sharp blade, but it's kind of to remove and scrape the cement off of the teeth. And lastly, the orthodontist would use high-speed tempers and polishing paste to smooth everything down, make everything pretty again. And when they finish treatment, we have to take records again, like the impression, the pictures, and then also the x-ray panel. And then how we're doing it right now is the appointment before the bonding, we'll take impressions for the retainer and then have that sent to the lab, and then when they get debonded, then that's when they get the retainer. And then they're done with their treatment. Anyone have any questions about this?
For the separators, when they put them on, do they not supposed to floss on that area, or?
Yeah.
That makes sense. A week.
What if it falls out?
And they have to call us like as soon as possible to get a book back in. Yeah, I think if it's like a day or before, then they said it's okay for them to just wait. I don't have any other questions.
So after this summary, Joey will do another session, making in detail like things. Right now, this is just an overview from beginning to end, which things will be done. Very good job. I like this presentation. So cute. Okay.